Hello everyone and welcome back to the channel. If you recently started Methotrexate for rheumatoid arthritis, psoriatic arthritis, lupus, inflammatory arthritis or another autoimmune disease, you've probably noticed that your rheumatology team keeps asking you to have regular blood tests. In fact, one of the most common questions I hear in clinic is, why do I need so many blood tests? Patients often tell me they feel perfectly well, so they don't understand why monitoring is necessary. In this video, I'm going to explain exactly why we monitor methotrexate so closely, what blood tests we check, what we're looking for, what happens if your blood tests become abnormal, and why these regular blood tests actually make methotrexate one of the safest medications we use in rheumatology. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology in London. Let's start with an important point that often surprises people. The reason we monitor methotrexate so carefully isn't because it's an unsafe medication. In fact, methotrexate has been used successfully in rheumatology for decades and has transformed the lives of millions of people with inflammatory arthritis and autoimmune disease. We monitor it because it works throughout the body, and regular blood tests allow us to identify potential problems long before they cause symptoms. Think of it a bit like having your car serviced. You don't wait until the engine stops working before checking the oil. Regular servicing identifies small issues before they become big problems. Blood monitoring works in exactly the same way. It allows us to detect early changes, adjust treatment if necessary, and keep patients safely on methotrexate for many years. So what exactly are we checking? The first blood test we monitor is something called the full blood count. This measures your red blood cells, white blood cells, and platelets. Red blood cells carry oxygen around your body. If they become low, you may develop anemia and experience tiredness, breathlessness, or reduced exercise tolerance. White blood cells are responsible for helping your body fight infection. Methotrexate can occasionally suppress the bone marrow, leading to a reduction in white blood cells. Although this is uncommon, if it does happen, it may increase your susceptibility to infections. Platelets help your blood clot. Low platelet levels are also uncommon, but are something we monitor carefully because they may increase the risk of bruising or bleeding. Fortunately, significant abnormalities are relatively rare, particularly when patients are monitored regularly. If we notice a downward trend early, we can often adjust the dose or temporarily stop treatment before serious problems develop. The second important test is your liver function. This is probably the blood test that patients ask me about most often. Methotrexate is processed by the liver, and in some people it could cause irritation or inflammation of liver cells. Blood tests allow us to detect this by measuring liver enzymes such as ALT and AST. If these enzymes become elevated, it doesn't necessarily mean permanent liver damage has occurred. In many cases, it may simply reflect a temporary irritation that settles after reducing the dose or pausing treatment. It's also worth remembering that abnormal liver tests aren't always caused by methotrexate. Alcohol, viral infections, fatty liver disease, and several other medications can all affect liver function. This is why your rheumatologist always interprets the blood test in the context of the whole clinical picture. The third blood test we routinely check is kidney function. Why is this important? Your kidneys help remove methotrexate from your body. If kidney function deteriorates, methotrexate can accumulate in the bloodstream, increasing the risk of side effects. By monitoring kidney function regularly, we can adjust the dose if necessary and ensure the medication remains safe. So those are the three main blood tests: your blood count, liver function, and kidney function. Some centers also monitor inflammatory markers such as ESR and CRP. These aren't monitoring methotrexate safety directly, but help us assess whether your arthritis is responding to treatment. If your inflammatory markers are falling and your symptoms are improving, that's encouraging evidence that the medication is working. One question I hear all the time is, how often do I need these blood tests? The answer depends on where you are in your treatment journey. When you first start methotrexate, blood tests are usually performed every 2 weeks. This is because most significant changes, if they're going to occur, are most likely to happen during the early stages of treatment or after increasing the dose. Once your blood test remains stable and you've reached the maintenance dose, the monitoring becomes less frequent. Many patients then move to monthly blood tests and eventually every 2 or 3 months, depending on local guidelines and individual circumstances. Patients sometimes ask whether they can skip a blood test because they feel well. My advice is almost always no. The whole reason blood monitoring works so well is because it detects problems before you feel unwell. Waiting until symptoms develop defeats the purpose of monitoring. Another question patients often ask is, what happens if one of my blood tests comes back abnormal? Firstly, don't panic. Abnormal blood tests are actually quite common and often don't mean you have to stop methotrexate permanently. Sometimes we simply repeat the test because mild abnormalities can occur for many reasons, including viral illnesses or temporary dehydration. Sometimes we reduce the dose. Occasionally we ask you to stop methotrexate for a short period while things recover. Only rarely do we need to stop methotrexate permanently because of blood test abnormalities. One thing that makes a huge difference is taking folic acid correctly. Folic acid helps reduce many of the side effects associated with methotrexate, including mouth ulcers, nausea, and some abnormalities in blood tests. That's why we routinely prescribe folic acid alongside methotrexate. It's a simple medication, but it's incredibly important. Patients also ask whether alcohol affects their blood tests. The answer is yes, it certainly can. Both alcohol and methotrexate are processed by the liver, so excessive alcohol intake may increase the risk of liver problems. Current guidance has become less restrictive than it used to be, and many patients can safely drink alcohol in moderation, but it's always worth discussing your individual circumstances with your rheumatologist. It's also important to tell your doctor about any new medications, including antibiotics, because some medicines interact with methotrexate. Certain antibiotics such as trimethoprim should generally be avoided because they can significantly increase the risk of methotrexate toxicity. One symptom patients often worry about is infection. Because methotrexate affects the immune system, if you develop a significant infection requiring antibiotics or you become quite unwell, your rheumatology team may advise temporarily stopping methotrexate until you've recovered. Again, this varies depending on the situation, so always seek advice if you're unsure. Let's now talk about some warning signs that should prompt you to contact your healthcare team rather than simply waiting for your next blood test. If you develop severe mouth ulcers, unusual bruising, bleeding, persistent high fever, significant shortness of breath, yellowing of the skin or eyes, or profound fatigue that feels very different from your usual symptoms, it's important to seek medical advice promptly. Thankfully, these complications are uncommon, but recognizing them early is important. One question that occasionally comes up is whether patients can simply have fewer blood tests once they've been stable for several years. The answer is that although monitoring becomes less frequent over time, it should never stop altogether. Even patients who have been taking methotrexate successfully for many years still require periodic blood monitoring. The risk of complications may be low, but it's never zero. Another common misconception is that because methotrexate is used at much higher doses in cancer treatment, the same risks apply in rheumatology. In reality, the doses we use for inflammatory arthritis are much lower than those used in oncology. That's one of the reasons methotrexate is generally so well tolerated when prescribed appropriately and monitored carefully. In fact, methotrexate remains the gold standard treatment for rheumatoid arthritis throughout the world. It has been studied extensively and we have decades of experience using it safely. The reason we prescribe it with confidence is precisely because we have these well-established monitoring programs in place. So rather than seeing blood tests as an inconvenience, I encourage patients to think of them as part of the treatment itself. They're one of the reasons methotrexate has such an excellent long-term safety record. I'd much rather identify a small change in your liver enzymes on a routine blood test than wait until you become unwell. That's exactly why monitoring exists. So if you've recently started methotrexate and you're wondering why your rheumatology team keeps asking for a blood test, hopefully you now understand the answer. We're checking your blood count to ensure your bone marrow is healthy. We're checking your liver function to make sure the medication isn't causing irritation. We're checking your kidneys because they help remove methotrexate from your body. And we're doing all of this so that you can continue benefiting from one of the most effective medications we have for inflammatory arthritis while keeping the risk of complications as low as possible. The most important message I'd like you to remember is this: regular blood tests don't mean methotrexate is dangerous. They're one of the reasons methotrexate is so safe. If you found this video helpful, please like, subscribe, and share it with anyone who is taking methotrexate or is about to start treatment. For more videos on rheumatoid arthritis, autoimmune diseases, and rheumatology treatments, don't forget to subscribe to the channel. And if you'd like a specialist consultation, I see patients at Pure Rheumatology London. Thank you very much for watching.